111E, and today I will be performing my return demonstration about assessing the cardiovascular system. Before to conduct of the assessment, I need to review my client's previous medical records and doctor order sheet if available, because it will help me to verify the order. Okay, so next I need to determine the scope of the assessment needed and prepare the necessary equipment such as a drape, working gloves here, and pen light. Also the rectangular card, centimeter ruler here, and also the stethoscope, because this will help me to ensure organize and increase efficiency in performing the assessment. And lastly, we need to perform hand washing to prevent the spread of pathogenic microorganisms, and also donning gloves if necessary. So, good day, sir. I am Catherine Pinatibon from BSN 111E at Davao Doctors College, and also your student nurse for today. So, may I see your wristband po? Can you please state your complete name?
Understand.
How about your birth date?
January 19, 2004.
Okay, so how would you like me to call you?
Anderson.
Okay, so Sir Andrew, before that, what language do you prefer, Sir Andrew? Okay, English. So for today, I'll be assessing your cardiovascular system, which means I'll be checking your pulse and listening for your heart sounds. And also, will that be okay? So before that, do you have any questions regarding the procedure? Okay, thank you. So, sir, would you mind if I close the door and also the window so that no one from the outside will disturb us during the assessment? And also, I'm going to adjust the temperature and also close the door. Okay, sir, before the procedure, I'll be asking different questions to you, sir. And also, do you have any complaints or feel any pain in your chest?
No.
And no. Okay, thank you. Have you experienced shortness of breath and headache? Do you have any history of cardiovascular problems?
No.
How about this? Do you smoke? Lastly, do you exercise?
Yes.
How often?
Once a week.
Okay, thank you, Sir Andrew. So, after that, we will begin to the assessment. And also, kindly take off your shirt, Sir Andrew, and I am going to drape your body to protect your integrity and enhance comfort.
Sure. Can you hold this?
Okay. Thank you. So, to start, I will first assess the jugular vein and carotid artery of the patient, because they can provide information about the blood volume and pressure of the right side of the heart. To do that, position the patient in a supine position here with the head elevated between 30 to 45 degrees. Sir, please arrange. Do you feel comfortable, sir?
Yes.
Okay, thank you. So that the head and torso are on the same plane, and instruct the client to turn his head slightly to the left and shine a light source onto the neck and suprasternal notch and area around the clavicles to observe for pulsations and shadows. Okay, can you please okay, thank you. And also, and if you see jugular distension, we should assess the jugular venous pressure by locating the highest visible point of distension, and we can raise and lower the head of the bed until we can observe the highest visible point of distension. And note that if the jugular veins is bulging, distended, or protruding at 45 degrees or so can indicate right-sided heart failure. And now I'll be measuring the vertical distance in centimeters above the sternal angle by extending a long rectangular card and a centimeter ruler vertically from the sternal angle, making an exact right angle, and repeat for the other side of the patient. Sir, can you please turn to that? So, with the head of the bed still slightly elevated at 30 degrees position, the client's head slightly towards the side being examined. And now I'm going to palpate the carotid artery on both sides, cautiously avoiding too much pressure or massaging the area. About the right side. Okay, thank you. And now, next, I'll be using my stethoscope and placing the bell over the carotid arteries and listening for a bruit or a swishing sound that is caused by a turbulent blood flow through a narrow vessel, and also repeat on the other side. So, okay, now I'll be using my stethoscope. Okay, sir, I will turn your head and slightly as I do that earlier. And now I will begin with a general inspection of the chest wall in women. Keep the right chest draped. Gently lift the breast with the left hand or ask the woman to do this for assistance. Stood at the right side here of the client with the head of the bed elevated at 30 degrees, and look for any abnormal pulsations, and also shone a light across the chest wall over the cardiac apex to make these movements more visible. Then inspect the precordium for any pulsations while palpating for the aortic, pulmonic, and tricuspid apical area. Okay, thank you. And now, we are going to proceed to palpate for hips and lifts using the palm or finger pads flat against the chest. Okay, and now, second, to palpate for thrills, I'll be pressing the ball of my hand firmly on the chest to check for a buzzing or vibratory sensation, which indicates a loud heart murmur caused by an incompetent heart valve. And now I'm going to proceed to the third. I'll be palpating for impulses using my finger pads flat on the aortic, pulmonic, tricuspid, and apical areas. Okay. Now, the last one is the fourth to palpate for the apical pulse. I'll be using the palmar surfaces of 2 to 3 middle fingers and to confirm the characteristics of the impulse. And I'll be using one finger only while noting for diameter, location, and amplitude. Now remember that we can reposition the patient to roll partly onto the left lateral side if we can palpate the impulse while the patient is in supine position. And if we can still palpate the impulse, ask the patient to exhale fully and stop breathing for a few seconds. And now, inspect and palpate the epigastric area of the base of the sternum for abdominal aortic pulsations. Okay, and for this part, I will assess the patient's heart rate and rhythm by placing the diaphragm of my stethoscope to listen for high-pitched sounds at the apex, listening to the rate and rhythm of the apical impulse. And now, to listen for the patient's heart sounds, I'll be using the diaphragm. Here, the diaphragm of the stethoscope, first then the bell, by placing them in all 4 anatomic sites, the aortic, pulmonic, tricuspid, and apical. Okay, sir, kindly breathe regularly while I am scoping, sir. Now, I'm gonna use the bell. And repeat this step while placing the patient in the left lateral position and also in a sitting position, leaning forward, and briefly stop breathing after exhalation. Okay, sir, can you please do the side lying position? And now I'm gonna use the belt. Okay. Okay, sir. Thank you. Okay, sir, can you please stand up? Okay. Okay, sir, thank you. And now, I will assess each arm for size, symmetry, skin color, and temperature from fingertips to shoulder. Note for any presence of edema, lesion, or changes in skin texture and hair distribution. Okay, sir, can you please do this to me? Okay, thank you. And thank you, sir. Can you, and proceeding with the upper extremities, I can see that everything is normal since the color is consistent, hair is evenly distributed, the temperature is warm, and there are no swelling, ulceration, venous patterns, and also varicosities. And now, palpate for a radial pulse, the ulnar pulse, and brachial pulse individually and bilaterally. Yes, sir. Thank you. Okay, sir, your pulses are bilaterally strong and grades 2 plus, which is normal. And now I will assess your capillary refill for both of your hands. Thank you. So now, surrender for the Allen test. It is done to test the patency of the radial and ulnar arteries. To do that, sir, please open and close your hands as quickly as you can and squeeze them afterward. And then open and again, then repeat to the other hand, please. Okay, can you do the open and close? Then how about the squeeze? Then open. Okay. Second one. Open and close. How about the squeeze? Okay. Then at the supine position, assess each leg for size, symmetry, skin color, and temperature from the groin to toes. Note for any presence of lesions, changes in skin texture and hair distribution. Yes, sir. I'm going to expose this part. Okay. So now, Sir Andrew, I will elevate your limbs, sir, to inspect the peripheral veins for the presence and appearance of the superficial veins. Okay. So, proceeding with the lower extremities, I can see that everything is normal since the color is consistent and also the hair is evenly distributed. The temperature is warm and there are no swelling, ulceration, venous patterns, and also the varicosities. And now I'm going to palpate for a femoral pulse, popliteal pulse, okay, and dorsalis, pedis, and posterior tibialis individually and bilaterally. Yes, sir. And now inspect the calves for ulceration, varicosities, redness, and swelling over vein sites. And now I will palpate your calves, sir, and check for any presence of edema for over the dorsum of your foot. Then push the calves from side to side to test for tenderness. So, okay sir, now I will dorsiflex or bend your foot towards you, sir. Okay, how about the next one? Okay, now sir, I will assess your capillary refill for both legs. Okay, sir. Our assessment for today is officially done from your chest area and also the legs. And now I'm going to assist you with your plugs. Okay, sir, now that we're done the assessment, so I'm going to summarize all the information that I've gathered earlier. So for your jugular venous pressure, sir, is normal, which is 6 centimeter. While I am listening for your carotid arteries, no presence of bruit, and also there are no any abnormal pulsations in the chest and any abnormal chest wound. And also with your upper and lower extremities, everything is normal since the color is consistent, and also the hair is evenly distributed and the temperature is warm. So there are no swelling, ulceration, venous patterns, and varicosities. So while the capillary refill, sir, of your both hands and feet are normal too. And lastly, your calves, sir, are normal, which does not have ulcerations, varicosities, redness, and swelling over vein sides. And lastly, there are no presence of edema over the dorsum of your foot. So, to conclude everything, sir, everything is normal. Okay, so, have you understood everything that I have said, sir?
Yes.
Okay, so do you have any questions, clarifications before we end this assessment? Okay, sir, that's all for today's assessment, sir. Thank you so much again for your time and cooperation. Well assured that everything that I have said regarding your assessment will be kept private to maintain its confidentiality. Thank you so much. So, now I'm going to perform hand hygiene or hand washing. Okay, now I'm going to document the findings in the client record using printed or electronic forms or checklists supplemented by the narrative notes when appropriate. Okay, so that's all for today. Thank you so much.